can you share an example of a project where community input significantly shaped the outcome?
Yeah, definitely. So I'm currently working for the Institute for Health Logistics and Analytics. That's based out of Georgia Southern University. And the project is called the Community Health Resource Project. So long names, but we call it CHIRP for short. And it looks at understanding rural health and populations in Southeast Georgia. We look at highlighting health assets in these regions, and we create asset maps, interactive asset maps, as well as a comprehensive report. We have currently wrapped up with, I think, 6 counties. We're in our ninth county. This is our final week of outreach for these next three. And then by the end of 2025, we'll be in hopefully 18 counties. This project really showed us that, you know, understanding communities as they are and how they are and leveraging that, a strength-based approach, which is really stepping into what's already available, what people are utilizing in order to be successful, how people are achieving their overall health and well-being. This project really showed us that even if we have one standard procedure of doing things, it is not a copy and paste. We're dealing with different counties that range from population sizes of 8,000 to, I think right now our highest population is about 44,000. And each of these counties have their own unique flavor, their own culture. They have set ideologies that kind of push these individuals forward, which tends to supplement our traditional understanding of what it means to achieve and reach optimal health. In rural health, you have inequities such as lack of transportation or distance to our traditional healthcare institutions, or even, the infrastructure looks a lot different. So we, although have a framework of how we interact with each county, we allow each county to tell us how to move forward and what to report, and how to engage with each county. So from that, we're in our reporting, we're understanding how to create and deliver workforce development strategies that are suggested by individuals and recommendations from us. So kind of a culmination of those two bits of information or those two streams of information that are coming in, to have those sustainable outcomes, whereby, in one county, we may see that there's a lack of youth development programming going on, but there's some organizations that are doing youth development, or doing adolescent development, but there's no youth development, that 15 to 24 age range. So workforce development strategies look like partnering with these organizations, but focusing on these specific health disparities and health outcomes that are prominent in those areas. So that not only are you educating the population on what's prevalent there, but you're also kind of planting the seeds in these young people on kind of caring about their community a little bit more, and hopefully maybe staying there. Oftentimes in rural counties, you have people who leave and never come back. So the other hope is that with this reporting, we're painting a picture and telling the story based off of the information that we're receiving from individuals of how cool and unique these places are and why they're such a gem and why people should stay there or move there.
Love that. Love so much about that. I think, firstly, like the strengths based approach, assets based approach, the idea of like creating a general model, but then having that model twist and turn, like depending what the community needs. I love having asset maps and thinking about how can we support community. I think these are things that are so important. And rural workforce development, I think, is a topic that we don't talk enough about, but it is something that's so important. It's like, how do we create communities where people want to stay? And I think that is essential, and that ties into so many different things like economics, health, and all those different intersections. I wanted to ask more about that youth engagement part of the work that you've done there. So, like, how have you all worked to engage the youth, and how does that show up in the work that you all do?
Yeah, so currently we aren't doing any youth specific programming. I love that you asked that question because when we're interacting with a lot of community members, there's one county that comes to mind, and we're all sitting at a table with them with a group of individuals who were essentially gatekeepers, key informants, and the movers and shakers of this county. And after we presented our approach or what we wanted to do to work with this county, almost everyone was like, "So what do you want us to do? You know, what's next?" And we were saying that's part of the strength based lens where it's we are allowing you to kind of dictate our reporting so that hopefully with these bits of information that we are putting together for you, um, which will include some sustainable outcomes, there can be long-term implementation that's done from this. However, comma, that doesn't necessarily mean that we will be the leaders with doing that, because it's first we want to have an understanding of the lay of the land. And if future initiatives or future projects come to be, we've already outlined or we've already put down the groundwork with building relationships, understanding areas of support or collaboration, understanding specific areas where these communities would love to continue to dive deeper. But for now, we're kind of just doing our strength base. Community engagement, building relationships, really understanding before doing a little bit more of the heavy lifting. Because many rural counties and rural members, community members that we're speaking to, they've said we couldn't tell you how many times we've had something like this happen where an academic institution or a nonprofit or another entity comes in. And I had a professor who would say this all the time, helicoptering in. They'd come in, get the information, and leave. And we are doing our absolute best to be intentional about not doing that. We've had about, I think, 5 or 6 projects through the IHLA that we've done previously. And even if those are different projects, they've been in these counties. So people are starting to see, oh, I have the IHLA, the Institute for Health Logistics and Analytics. You provide COVID mitigation supplies to our confinement facilities. And now you're back doing this community strength based work. We're trusting you even more so that whatever resources or opportunities come your way or our way, we can actually work together collaboratively for sustainable outcomes.
And I think that that's very important as well. And I think understated a lot in this week is that relationship building part of thing, that trust building. And in public health and in all different fields, we know too often, as you're saying, that helicopter dynamic where people come in and then they start something, but then maybe the community never sees the end product, or they aren't part of the implementation, or maybe this funding dries up and then the project kind of dies. And I think it goes to show just how intentional we do have to be in going into these communities, because we don't want to be, is it the boy that cried wolf, and then
Yep.
when you actually need them, they're not there. But I think that that approach is awesome.